Hi, it's Crystal with birthingunconsciouschoice.com. Today I want to talk about a subject that I don't think gets enough discussion in pregnancy, and that's circumcision. Granted, it's not always something that people want to think about. Maybe they're not even, sure if they're going to have a boy or a girl. Maybe they want to leave it up to, to the dad, or maybe they just, do whatever their doctor or healthcare professional recommends. Circumcision is kind of a big deal, though. It's something that deserves a lot of consideration. It's one of the first really huge, non-revocable parenting decisions that you can make. And it's unique because it's not just a simple choice. I think a lot of people try to put it as, well, it's the parent's choice. Well, but it's not your body. It's not, you're making a choice about your child's body as if it was a piece of property. And I think if you give that any deep consideration, I don't understand how that can sit well with people, to make decisions about a healthy part of their child's body, and to make the decision to remove it. Circumcision is not just a little snip. It's major surgery. It's often done without the use of anesthetics. Yes, I'm not kidding. There are plenty of hospitals out there that do, but there are also plenty of hospitals out there that do not use anesthesia of any kind. They still are perpetuating the lie that infants can't feel pain, or the more insidious position of, well, they're so little they won't be able to have a conscious memory of it. And I think that's absolutely not true. I think that just because they can't have a conscious memory of, I was in pain when my penis got cut, doesn't mean that it's something that, is okay to do. From birth as, a nonviolent process, and welcoming the baby in an environment of nonviolence, and then to go and do something like circumcision, whether it's a couple days after birth or a couple weeks after birth. It is undeniably a traumatic event, whether you're having it done by a rabbi, or a hospital outpatient procedure. It's undeniably painful. It has the potential to be dangerous. Complications of circumcision involve death by hemorrhage, because it's such a sensitive vascular area. It's easier than you would think for a baby to actually bleed significantly from their circumcision wound to the point of hemorrhage and blood loss, and death through blood loss. It's happened before, and it's a horrible tragedy that shouldn't, it's needless. There are a lot of myths about circumcision, that it's, somehow cleaner. But there's no other part of the body that we would, surgically remove a healthy piece of tissue because it was cleaner. Even things like, tonsillectomies or appendectomies, to remove tonsils or appendix, they aren't really, performed anymore, because the risk outweighs the potential of benefits down the road. So, wouldn't it be logical that it would be much easier to just teach your boys how to wash themselves properly? It's a simple thing to do, and the foreskin is not even retractable. It's retractable sometime between age 1 and age 10. There's a very wide range of variance of what's normal. And the only person that should ever retract a boy is himself. There's no, awkwardness of diaper changes. You just wipe it like a finger and it's clean. There's no risk of infection with a non-circumcised boy with issues of cleanliness. If anything, there is much more risk of infection due to lack of cleanliness with an open wound. There are also risks depending on the type of procedure used. Circumcision takes away a lot of healthy tissue. It has a deep impact on the sexual health and physical health of boys as they grow older. And it's something that can't be changed. You can't grow back a foreskin. There's foreskin restoration procedures, but they're costly and painful and time-consuming, and they only restore a small amount of what was taken away from them through circumcision. It's something that you really can't get back. And finally, I think, regardless of any other argument for or against circumcision, to me what it comes down to is choice. It's not your body. You don't own your child. Your child is not a piece of property. Their body is not yours to make decisions about. And for the record, I feel the same way, or similarly, about things like piercing an infant girl's ears. For instance, it's her body. But even ear piercing is incidental compared to the significant, impactful loss of a foreskin. The foreskin has so many functions that we're not even considering. It's not just a simple snip. It's not just a cosmetic surgery. It's so much more to it than that. And, the tide is shifting slowly. Only about 50% of boys in America are circumcised now. So if there's the question of, oh, I don't want him to look different from his peers, even if that was something to care about, even if that was a legitimate reason to care, to alter your opinion on circumcision one way or the other, know that the tide is shifting. Circumcision is slowly becoming recognized as the archaic, unnecessary surgery that it is, and it's being phased out. So babies born today, it's going to be more common to not be circumcised. And I look forward to the day when circumcision in America is as uncommon as it is in Europe and in other parts of the world, where it's only done in terms of, it must be a religious procedure. And for the record, even if you follow a religion that traditionally circumcises their boys, there are alternative religious celebrations and ceremonies that you can participate in. There are non-violent, non-bloodletting ceremonies that you can do as alternatives and still keep your faith. I understand that it can be a matter of faith, but ultimately, to me, it comes down to his body, his choice. So think very deeply about circumcision. It's not something that you can take lightly. It has enormous impact on the health and wellness of your child, both physically and psychologically, for his entire life. It's one of the biggest parenting decisions you'll ever make. Please, please think deeply about it.